My name is Teresa Baxton, and this is my positive negative airway project. This is my thoracic cavity that I built. This is the rib cage, the bottles on the outside. The bags work as the diaphragm. This represents like the bronchial tubes, and then this represents the trachea. These are a little hard to see, so I made a second one. And again, it's the same thing. The clear bottle represents like the rib cage. The blue glove represents the lung. The bag is the diaphragm. This would be like the bronchial tubes leading to the trachea. The act of inhalation is the active process. When you breathe in, the diaphragm contracts downward, creating negative pressure and fills the lung with oxygen. When you breathe out, the diaphragm relaxes and goes back upward. That is the passive process. When you breathe out, the diaphragm creates a positive pressure. So, demonstrate. Breathing in, breathing out. In, out. And this is where the oxygen in the alveoli meets the carbon dioxide. So when you're breathing in, that's where the gas exchange happens. When you breathe in, it fills with oxygen, exchanges in the alveoli with the carbon dioxide from your blood, and then when you breathe out, you're pushing out all of that carbon dioxide. So reoxygenating the blood. Now, I'm going to demonstrate what happens if there's damage to it. So you just remove this. Here's a hole that I created right here. So when you're breathing in, the glove can't fill, the lung can't fill quite as well. It doesn't work as well. So what you would do would be like an occlusive dressing, putting it over that hole to seal it off, and then you're able to have good oxygen flow back. Question 1 was, when providing artificial ventilations or manual ventilations, what can be some physiological problems when overinflating the lungs? My answer to question 1 is, each time you deliver ventilations, you are making the intrathoracic pressure positive. More frequent ventilations can cause a greater duration of positive pressure in the chest than a patient with normal spontaneous breathing, which further impedes blood return and reduces cardiac output and perfusion of vital organs. So you're not able to get that the proper amount of gas exchange. Question number 2 was, a patient breathing too rapidly or too slowly can affect a patient, whether by their own efforts or by artificial means. Explain the physiologic changes when inadequate ventilation occurs due to too slow or too rapid of respirations. My answer to question number 2 is, when inadequate ventilation occurs due to either too slow, so bradypnea, or too fast, tachypnea, respirations, the primary physiological change is an imbalance in blood gas levels, leading to either a buildup of carbon dioxide, or in the case of slow breathing, or a decrease in carbon dioxide with rapid breathing, both of which can impact the body's pH balance and cause various symptoms depending on the severity. Additionally, inadequate ventilation can also lead to reduced oxygen levels in the blood, if the rate of gas exchange is insufficient. Question number 3 was, what happens when the chamber is damaged? And to give an example of a pathophysiological disease process or problem, that would be, and what would be the signs and symptoms, and explain what can be done to correct the problem or make it better in the pre-hospital setting. I did demonstrate what would happen if there was like an injury to the thoracic cavity with the hole that I created, and then covering it to seal that off again, and how the lung is able to function better. I also have interstitial lung disease, or also known as ILD, is a term for a group of conditions, about 200, that cause inflammation and scarring in your lungs. Symptoms of ILD include shortness of breath, a chronic dry cough, fatigue, and chest discomfort. ILD can be caused by medications, radiation therapy, connective tissue diseases, or inhaling harmful substances. Lung damage caused by ILD is often irreversible. There is no cure for ILD, and treatment usually focuses on treating any underlying disease and improving symptoms. In a pre-hospital setting, oxygen administration would usually be the most helpful treatment for most patients with ILD. Thank you.